I have a real love right now for minimally invasive surgeries. This is something that we've developed over the past couple years. The technology is now allowing us to do this. So what this means is through very tiny, tiny punch holes, I call them, maybe about 1/8 of an inch big, I can insert a percutaneous cutting device, percutaneous meaning through the skin. And then I use live x-rays during surgery, so I have to wear lead the whole time. And I can actually do the bone cuts that I need to do and move the bone around to where I want it through these tiny, tiny incisions. And what that does for you, not only does it reduce the scar, and there's almost no scar, but it actually, because you're not making a big incision and a big dissection, it actually shortens the time to recovery, because what you need to heal is blood and blood flow, and those dissections disrupt the teensy tiny blood vessels, the capillaries. Your body has to rebuild those before it can even begin to heal you. So by minimally invasive surgery, we don't disrupt any of that, what we call the biologic envelope. And then that lets you heal so much quicker. I've had people after minimally invasive bone cuts be able to weight bear within a week. So it's been pretty awesome. Sometimes I'll want to put a pin to sort of train the bone in the direction I want it to go while it's healing. But generally speaking, I try to do this without hardware if at all possible, so that at the end of the day, when you're done, when you're healed, you don't have any foreign metal in your body, and your bones are where you want them, and you've healed quickly, and you hardly have a scar. So that's sort of where I've gone in my evolution, but this isn't for everybody, and sometimes the deformities are too big, sometimes it's too much of a revision case, sometimes there's too much arthritis, but if at all possible, I'll do this for you. The funny thing about minimally invasive surgery is because you're not putting the hardware in and you're not putting the bones exactly perfectly where you want them, you're doing more of, you're making the foot look good and not the x-ray look good. Sometimes the x-rays look a little goofy for a while, but the foot always looks awesome and the recovery is so fast. I mean, and the swelling goes down quicker, the pain goes away quicker. These are some x-rays from minimally invasive procedures. Now, the one on the top left is with hardware, but you can see how the metatarsal is over, but the bone cut was here, and this whole part of the toe was shifted over. And then a screw is sort of going almost through empty space from one side of the bone into the other one. That's one minimally invasive technique, and you get a better idea of that with the intraoperative x-ray on the bottom left, showing you how the bone is completely displaced and just held by those two little screws. But that heals very quickly and very reliably because you have not disturbed the biologic envelope. I like to do more on the right side with the wires, the pins, because I can pull those out and leave you with no hardware. And then you can see the scar. Where's the scar? There's really hardly any scar with this technique. So that's been a lot of fun and gratifying for me to be able to do this for people to correct their deformity with minimal to no scar. But again, I can't do it for everybody. Everybody's different, and you saw that algorithm. But if it's possible, we'll do it this way.